Hello, today I will be doing my informative speech on depression. Depression is a serious mood disorder that affects our mental ability. There are different types of depression, but the two most common ones are major depressive disorder and chronic depression. The less common types are bipolar disorder, manic depression, persistent depressive disorder, psychotic depression, prenatal postpartum depression, which women can get after they give birth, seasonal affective disorder, which can occur when seasons change, premenstrual dysphoric disorder, which can happen when you get your monthly cycle, and atypical depression. What is depression? Depression, major depressive disorder, or clinical depression is a common but serious mood disorder. It can cause severe symptoms that affect how you feel and think, handle day to day activities such as sleeping, eating, going to work, showering. To be diagnosed with depression, symptoms must be present for at least 2 weeks. Some of the symptoms are persistent sadness and anxious or empty feelings of hopelessness, irritability, feelings of guilt, worthlessness, or helplessness, decreased energy or feeling fatigued, moving or talking more slowly, feelings of restlessness or having trouble sitting still, difficulty concentrating, remembering things, or making decisions, appetite and weight changes, thoughts of death or suicide attempts. Not everyone that has depression will experience every symptom. How to be diagnosed with depression. Depression is often ignored or wrongly diagnosed, and if it's left untreated, it can be life threatening. Major depressive disorder has a high suicide rate. If you or your loved one are having symptoms of depression, I highly recommend that you go see a healthcare professional because they can help you find the right treatments. Usually, most primary care doctors can diagnose and treat depression. If your symptoms don't improve within 4 to 8 weeks, you can ask your primary care doctor for a psychiatrist referral, and they might be able to help you um, a little bit better um, than the healthcare provider. Treatment for depression typically involves medications and psychotherapy, or even sometimes both. If these treatments do not reduce symptoms, um, brain stimulation therapy might be another option. In milder cases of depression, the treatment might just begin with psychotherapy alone. Medication may be added if the individual continues to express symptoms. Um, for moderate and severe depression, mental health professionals may recommend a combination of medications and therapy from the very start of the treatment. I too suffer from depression and it's horrible. I wouldn't wish it on anybody. Every day I struggle to get up and to get things done, but I just keep going and I try my hardest. In conclusion, if you think you are suffering from depression or know someone that is, don't be afraid to reach out to them to see how they're doing. Don't be afraid to go get yourself help because you are not alone and you are loved. Sorry, I'm new to this whole thing, but here are my references. I hope you enjoyed my informative speech.